I also wanted to mention that there currently is a bill that's in legislation, H.R. 2159, that in part will hopefully assist in directing funds towards these very important issues. And this particular issue is how we can improve the way that we detect prostate cancer, and then also how do we determine which forms of prostate cancer are more appropriate to treat. I think that's what really is the crux of the issue here. I think applying broad sweeping policies to a very complex disease is not the way to solve this problem. And I think that's exactly what the panel from the U.S. Preventive Services Task Force has done. As a past president of the R. Frank Jones Urology Society, which is the only organization in this country that represents the interests of African American urologists, I'm very proud to share their position statement. They also represent the Urology Section of the National Medical Association and are also recently a subspecialty society of the AUA. So that really, for me, puts me in a position of comfort in sharing this position statement. And I will read it so that I don't get it mixed up. So on behalf of the Urology Section of the NMA, prostate cancer continues to pose a significant health concern in the United States. It's estimated that over 240,000 American men will be diagnosed with prostate cancer this year. Additionally, over 33,000 men are expected to succumb to the disease. It is second only to lung cancer and cancer-related deaths. Significant racial disparity exists for African American men diagnosed with prostate cancer. In fact, African American men are 60% more likely to be diagnosed with the disease and over twofold higher death rate associated with prostate cancer compared to any other ethnic group in the United States. Efforts at early detection of the disease is particularly critical for African American men who have a 3 to 4 times higher risk of presenting with metastatic disease, which means that the cancer has already left the prostate, particularly in men under the age of 60 compared to any other ethnic group in this country. Recently, there have been concerns that the PSA screening results in overdiagnosis and overtreatment of prostate cancer, along with potential harmful effects related to diagnosis and treatment. Recommendations have been made by a federal panel to limit the use of PSA as a screening test. These recommendations are primarily based on observations from large clinical studies performed in Europe, Canada, and the United States. However, very few African American men participated in these studies. As a result, the findings of these studies may not be generalizable to the African American community. Since PSA testing was initiated, a clear trend towards declining mortality rates among prostate cancer patients has been observed. As Tom mentioned, 40% decline over the last 2 or 3 decades. Although PSA screening cannot readily separate aggressive from indolent cancers, it currently represents the best method of early detection of curable prostate cancers. The R. Frank Jones Urologic Society and the Urology Section of the NMA therefore support the use of PSA in early detection of prostate cancer as a means to support health promotion in African American men. Moreover, we endorse the AUA's best practice statement on prostate cancer early detection, which includes initial PSA testing at 40 years, both digital rectal exam as well as PSA testing as part of the screening. An informed decision-making process should occur as part of this screening. And finally, utilizing multifactorial assessment of risk based on age, ethnicity, family history, and other modifications of the PSA test, such as PSA velocity, density, etc. So in keeping with the NMA's mission, the Urology Section also strongly supports a community-based approach to prostate cancer early detection, which features education, improved access, and patient-provider dialogue, as well as promotion of health-seeking behavior in underserved populations. And so, once again, applying a broad sweeping policy to dealing with this disease that shows clear disparity among different populations, in my opinion, is quite short-sighted. And I'm sure that we'll have other individuals speak on this matter. So thank you very much.